Hi everyone, welcome back. I'm with Dr. Watson. How you doing, Dr. Matthew Watson?
Very good, thank you.
Okay, and you're with, tell everyone.
Well, I'm with the MACT Medical Clinic here in Jackson.
Okay.
I'm a member of the U.S. Public Health Service. I'm a commissioned officer with them, a physician in general internal medicine. I see patients, Indian patients, and also local community members who are non-American Indian and Alaska Native as well.
Okay, so you're with the Indian Health Service as well? Are your two jobs intertwined? In other words, you have two hats that you wear?
Yes and no. The Indian Health Service is a federal agency that is charged with taking care of the American Indian Alaska Native population in all 50 states. The commissioned Corps, the U.S. Public Health Service, of which I'm a commissioned officer, I was commissioned in that group separately. So the Indian Health Service has civil servants, federal employees, and commissioned officers like myself.
Okay. All right. And I guess what I was trying to say is, do you have two clinics that you oversee?
I am the site supervisor for the MACT Medical Clinic here in Jackson, just up the road actually. We have 3 other medical clinics in Calaveras, Tuolumne, and Mariposa counties, as well as 2 dental clinics and a behavioral health.
Okay, let's talk a little bit about healthcare and the healthcare under the new, the affordable healthcare vision, more commonly called Obamacare.
Sure.
Now that it's been ruled on and it's constitutional, I imagine it's taking into effect. And actually, I believe California jumped on it right away and started to implement it. So we're probably ahead of other states. Why don't you tell us some of the things that are happening? And you must know far more than me.
Well, I've been following the news and other organizations such as the American Medical Association, the California Medical Association, and the Kaiser Foundation. There's a lot of good information out there. And what I found is there's a lot of bad information out there also. I think it's very confusing, and it's understandable. When I looked at the document online last night, just to refresh myself for this program, the original document is 2,409 pages, and I'm not convinced that our congressmen have actually read all of those pages. I can't even see how I would read 2,900 pages. It's very, very complicated. Now, the American Patient Protection Affordable Care Act was created in 2010, in March of that year, by Congress, and the President signed off on it. It was a way to help deal with many healthcare issues that we have in this country: primary care shortage, skyrocketing cost of healthcare, the number of people in the United States who are going bankrupt. It turns out that medical bankruptcy is the #1 cause of bankruptcy in America today. There's all of these things, and we're paying #1 in the world in terms of how much money we give, but we're getting not great care. So this was kind of a way to do that. Now, a lot of the things have already been in place, a lot of these parts of the Affordable Care Act. Some of them people like, some of them people don't like, but some of the ones that are notable that most people like are a couple I wrote down here. One is you can't deny children care based on pre-existing conditions. That's really important. Something that's very important to seniors that is already rolled out, piecemeal between now and 2020, is they're going to close that Medicare Part D donut hole that they keep talking about, where people will have to spend a certain amount of their money. And a lot of seniors are fixed income. They can't afford to do that. Another very helpful thing for some families right now, especially in this very tough economy, is that children are able to stay on their parents' insurance until 26. Those are things that have already come into way. But last week was the big news, right? The Supreme Court had weighed in on the constitutionality of everything. And what they specifically looked at were 2 things. One was, is the individual mandate saying every American must have health insurance? Is that constitutional? And the second was, do states have to accept the Medicaid money and all the restrictions around those from the government? And what the Supreme Court found in the 5-4 decision last week, it was a split decision, was that yes, the mandate is considered constitutional in the form of a tax, which is very controversial, as you know, especially in these times. But they said, you know what, the Medicaid expansion, that's not constitutional. You can't coerce states.
They said that you can't hold a gun to the state's head.
And that's exactly what the Supreme Court said. So that has now been made optional. So really, in the end, this whole Supreme Court, all of the things that happened.
Let's talk about a few of the points that you had, and
Sure,
you can discuss those. And of course, I believe in the news, everybody knows now there's 16,000 IRS agents to handle the tax, since it's seen a tax. So that's in place, but we have no new doctors. This does not give us any doctors. It puts 30 million more people into the healthcare
arena.
Arena. Thank you for the word there. So we have that many more people coming in, and so how does it seem like we would get better care?
Yeah. So I think in just speaking to some of the other local physicians who here in Amador as well, I just talked to them yesterday when I knew I was going to be on the program and see what do you think about this? And we a couple of us who kind of put our heads together, and we think that one of the big problems here is exactly what you said. We're already in a primary care shortage. We can't find enough doctors and mid-level providers, nurse practitioners, physician's assistants to take care of everybody now. You add 30 million more Americans into this, it's going to be nice, they're going to be insured, but we've still got to see somebody, have somebody to see these patients, and that's going to strain the system.
Do you think it's true that the 30 million more Americans that are having to get health care coverage to be in the system were people that chose, probably because they were younger people, not to get insurance at this time because you might have thought, well, like most people, I'm going to need that when you get up to Tom's age here, then you certainly want it. But right now, maybe I want a car, help the house, get something, So people that the people that are being added to it probably don't need the coverage as much, or at least they decided at their time that they didn't need the coverage. How do you feel with that?
Yeah, I suspect that there are probably a lot of patients in that case. But what we do know is that there have been a lot of people who have been denied for pre-existing conditions, a lot of young folks who have no access, and it does help
I believe
those
that
folks.
that number was, when the statistic came out, that people were quite surprised how low the number was of people that signed on to have pre-existing conditions. Now, that doesn't mean it doesn't happen right here in this studio. We have an employee that's in those sort of circumstances. And since California, we have a short period of time, but since California came on board rather quickly, I think he's already taken care of.
Good, good.
Okay?
Sure.
And we're going to have you come back because, you being in the driver's seat to help deliver a lot of the care, probably understand a lot of the rules more than some of us are just reading about it. Okay?
Very good.
Okay. So thanks, Doctor, for coming by. And stay with us. There's more news on the other side of the break.
You're watching Amador County's #1 news and sports leader, TSPN.